Good afternoon, everyone. Thank you for joining us today. It is my honor to welcome you to the October Interdisciplinary Grand Rounds. My name is Sarah Cable, and I am the Outreach Coordinator for the Office of Interdisciplinary Programs. The Office of Interdisciplinary Programs is housed in the Office of the Vice Provost for Academic Affairs and Faculty Development. Our office is charged with the development, implementation, operation, and evaluation of campus-wide interdisciplinary and interprofessional education requirements. Today, this will be referred to as IPE, the acronym for interprofessional education. We'll begin shortly, but first, a few housekeeping items. Today's presentation will be recorded for future reference. Please remember to mute your microphones and use the chat function to ask any questions. And we will also have time for Q&A with our panelists at the end. Today, I will be your Zoom facilitator, and you may message me directly with any technical issues. Without any further ado, we'll begin today's presentation, and I would like to introduce Sam Swafford, who is the chair of the ISC this year.
Thank you, Sarah, for that lovely introduction. And without further ado, I am very excited to present our October Grand Rounds covering vaccine hesitancy and our lovely panelists who have agreed to join us here today. Today we have Taylor McLarty, who is our SGA liaison to the council and a Doctor of Pharmacy candidate. We have Christina Bellack, an MS3 student and vice chair of mobile outreach for Unity Clinic. We have Jacqueline McDaniel, who is from the Oklahoma Alliance for Healthy Families, and Dr. Melissa Croft from the College of Nursing. At this point, I invite Taylor to hop on and give us just kind of some brief background about your involvement with vaccine advocacy.
Yeah, so I'm Taylor McLarty. I'm a second-year pharmacy student, actually, but I've worked in retail pharmacy for about 7 years now. Definitely doesn't make me an expert, and it feels like I've been there forever, but it's only been 7 years. So I kind of got started with vaccine advocacy towards the beginning of the pandemic, as I'm sure a lot of us did. Working in retail pharmacy, they play a big part in vaccinating the community. So it was kind of my first experience, I guess, with vaccine hesitancy at all. I hadn't really ever had anybody or any patients that were scared to get a vaccine, other than the fact that, the typical, oh, when I get the flu shot, it gives me the flu kind of thing. So that was really my first experience with any sort of like hesitancy behind getting a vaccine. And so it just kind of interested me into becoming more of an advocate for vaccinations, just because of how important they are and how important pharmacy is in vaccinating the community and the role of a pharmacist. So,
well, thank you. I'm glad to have you here. Christina, would you mind giving us a little bit of background and how you've gotten involved with vaccine hesitancy and advocacy?
Sure. Hi, guys. My name is Christa Bellack. I'm a third-year medical student, and I'm the former vice chair of mobile outreach for Unity Clinic. I'm also a assistant in the IP office. And so last year, I was able to work with a team of faculty and staff to help put on some community vaccine clinics throughout the metro. And our hope was really to make vaccine more accessible, more convenient for people. As the turnout at large megapods kind of decreased, we hope to bring vaccines to people. And through that, we had a lot of great conversations with community members who felt hesitant about the COVID-19 vaccine. It gave us a lot of space to kind of talk through those issues with people. And so that was my experience with COVID vaccines, and I am very happy to be here. Thank you guys for having me.
Of course. Ms. McDaniel, would you like to give a little bit of an introduction and background and maybe tell us a bit about the Oklahoma Alliance for Healthy Families?
Absolutely. First of all, thank you so much for including me on this panel. It's really an honor. So my name is Jacqueline McDaniel, and I am the Executive Director for the Oklahoma Alliance for Healthy Families. We are a 501c3 nonprofit organization where our goal is to improve immunization confidence in Oklahoma through education and advocacy. We work with a coalition of healthcare associations like the State Medical Association, the Oklahoma chapter of Academy of Family Physicians, Academy of Pediatrics, the Nurses Association, but also with other organizations like the Oklahoma Caring Foundation and other nonprofits like the Variety Care and Tulsa Area Immunization Coalition. And many, many more. So we work closely also with public health and parent advocates in local communities to be that voice for those most at risk of experiencing complications through vaccine preventable diseases. So we work with local advocates and grassroots advocates, both at the state and local level, to really educate and have conversations with policymakers, both at the state capitol, but also folks that make policies locally, to encourage and to educate them about maybe misinformation or disinformation that they may be hearing.
Absolutely. I am so excited to hear your unique perspective today. And then Dr. Kraft, would you like to give our audience just some background about yourself and how you've been involved in vaccine hesitancy?
Sure. And first of all, I want to say congratulations. We have 32 people on this call. And so I'm really thrilled about the number of people that are interested in this topic. So I'm a nurse. I'm an oncology clinical nurse specialist. I'm the Associate Dean for Clinical Affairs, Outreach and Practice Innovation at the College of Nursing. And my role in vaccines and vaccine hesitancy has obviously been as a vaccinator and as an individual who mobilizes a large workforce of people who can get shots in arms, meaning our students. It is probably the most fun that I have had through the pandemic, if we can say, giving shots is fun, but having the opportunity to take this, just like my colleagues have said, after we got through with the very large events, taking it to communities, I worked with Drs. Wendelboe and Chow in working with Guiding Right, the Latino Community Development Agency, several local churches, many of them, all of them with our interprofessional colleagues, to get shots to the people where it's easy for them to get them. And just like my colleagues said, all along the way, engaging in conversations with, like the questions we have today, why should I get vaccinated? What happens if I don't get vaccinated? What happens if I do get vaccinated? Just all kinds of questions that come up and opportunities to help people make decisions. And not only that, all of us have individuals, because we are healthcare professionals. We have family members, we have next door neighbors, we have people that we bump into in stores. All of them have their own beliefs and feelings about this. And so it's great that we're all coming together to talk about what we do to help people make decisions.
Absolutely. And for our audience, we are about to move into the start of the question period. I'm going to present a few questions up front, and then we will open it to audience questions. So if you come up with something, write it in the chat, but don't click send until I do open it up for audience Q&A, okay? So thank you to our panelists for your brief introductions, and I hope everyone got to hear the lovely background for everyone. My first question that we are going to ask our panelists is, why should I get vaccinated? If a patient comes up and asks you this, what is your initial response? And whoever can start us off there.
I can start off. So, I think first thing is vaccine preventable diseases have not gone away. There are measles and chickenpox. Those are alive and well. in other parts of the world. And so polio, for example, well, that's a whole other story of how that happened here in the US. It is an example of that there are no boundaries, that just because there is maybe no cases of chickenpox or measles doesn't mean that that can't be easily brought over to Oklahoma. But also that immunizations are part of an overall public health strategy. I mean, it's overall about being healthy. It's along the same lines with eating healthy and exercising. It's vital to keeping our community safe. And as Dr. Kraft mentioned, that there are people in our lives that may be immunocompromised. We may be in the library. We may, if your child or your cousin or whoever you're with may be at risk of getting sick or contracting a vaccine preventable disease. And so there, a lot of times folks, their choice of having to live in a bubble, that's taken away from them if other folks choose not to vaccinate.
Absolutely. You bring up some great points. I would like to open it up to our other panelists to take a crack at it.
I'll just follow up. Go ahead, Christa.
Go ahead, Melissa. Okay, sorry. I'll be quick. Something that I talked about in the community with folks is kind of finding your why for getting vaccinated. And so I think the best strategy, at least for the COVID vaccine with so much conversation around it, is talking about why you decided to get vaccinated. How you feel after getting vaccinated, and your own logic thinking through it, especially as a healthcare worker. I feel like people feel like we just say, just get vaccinated, just do it. But sharing your why. So like Jacqueline was saying, maybe it's you have a family member who is immunocompromised and you would like to see them without the fear of spreading any diseases. Or it could be, I've heard before, I just want to go on vacation, I miss traveling. Or it could be like the collective responsibility of getting through the pandemic. But first sharing your why and then helping them find theirs, I think is really helpful, especially for people who maybe are experiencing just some vaccine complacency and not feeling the need to go do it just because they haven't really been thinking about it. Maybe it hasn't really affected their own, circle yet, or things like that.
Absolutely. And that's kind of what I was going to say as well, Chris. I think we all have the same message. I've heard a lot of times from people who are healthy, people who are like, if I get it, it's not going to be that bad. It's not going to make me that sick. And so when they, just like you said, finding the why may not exist for what you're worried about your own self. For some people, the answer to that is altruistic. It's my little piece. It's my piece to move us out of this pandemic for this particular COVID-19 vaccine, because I may be fine if I get it. But if I don't know I have it, which that we know that certainly can happen, and I give it to someone else who is immunocompromised or who is an infant, and I don't want to do that. So it's my little piece. And then one other thing I'll say real quickly, several of my answers are going to be prefaced from a book. And I'll put this in the chat, and maybe some of y'all have read it. There's a book called Think Again, The Power of Knowing What You Don't Know, is by Adam Grant. It is an amazing book about how to really break down why you think something about something, how you change your mind as an individual, but also how you engage in conversations with other people about decisions and how they're making up their mind about things. It's an incredible book. And like I said, I'll put it in the chat. But one of the things that he talks about doing is to kind of then rephrase the question, what would make you, just like finding your why, what would make you interested in taking the vaccine? Because we can tell people all day long facts and data about why we think, but just like Christa says, it is not usually a cognitive decision, it's an emotional decision about what to do. And so if we can get to, just like you said, the why, what would make you interested in it, then we've really come a long ways in helping them with that decision.
Absolutely. And thank you for volunteering such a great resource. I'm definitely going to put that on my reading list. It's getting longer as the year progresses, of course.
If I can also just add on top of that, and I know that we're talking primarily about sort of maybe one-on-one with patients or clients, but another way is is also using social media as a tool, and sharing that information. So if you are getting the flu shot yourself, taking a picture, posting it to your social account, and giving your why there is a great way to for those people that maybe are in your social network. Your friends who may see and they may have questions. They may open up a conversation right then and there, or they may feel more comfortable that you went ahead, you got whether it was COVID, whatever vaccine it was, that opens up some comfort level for them. And also to say and being realistic on what those the after effects are. It's like, yeah, I didn't feel really good about it, but I slept it off and I feel great now. Allows people to feel a little more comfortable.
No, I think that is a great point to bring up when we're talking about just why should you get a vaccine. I'm going to move us on to our next question, which I have as why or how do you recommend approaching the discussion around vaccines without really getting into that inflammatory category or position that people who have hesitancy might hold?
I can take this one, I guess. So I think that, well, with pharmacists, we're one of the most accessible healthcare providers of the healthcare team. In fact, in Oklahoma, in all 77 counties, there's at least one pharmacy. So it makes pharmacists just very accessible to the public. And every day I find myself, almost every day I'm in practice counseling a patient on a vaccine, why do I need to get this? I really want this, things like that. And for me, I think it's just very important to remember that not every patient's religious beliefs, cultural beliefs, things like that are the same as mine. And I think that not even just with vaccines, but with everything, it's important as a healthcare provider to be able to put your own personal opinions and choices aside, to be able to educate and accurately provide information to that patient. That was actually one of my questions when I interviewed to get into pharmacy school, was how or what I thought about mandating vaccines, actually. And so kind of my answer was like, I think that it's my job to provide the patient with information, factual evidence, not calling them dumb or silly for what they think or what they saw on social media or whatever. Just making sure I am presenting them with the facts, and then ultimately letting them make their own decision and not getting personal about it, I guess, not really throwing my own opinion in there unless they ask for it, because a lot of patients are like, oh, well, what would you do, or what are you going to do? But I just think that's really important to remember.
I completely agree. Our own personal biases affect us in more ways than we usually remember. Jacqueline.
Yeah, and I think there needs to be sort of a clear distinction between folks who are truly anti-vax and folks who are vaccine hesitant, because they're not the same. And I think that definitely it changes the conversation, or how well or how badly that conversation goes. So truly anti-vax folks are not certainly in any interest in hearing the conversation. But truly vaccine folks who are vaccine hesitant, there's an opportunity to be kind, to hear their why, right? To understand what they're coming from, because there may be reasons that that they've heard that's part of their culture, but really being sort of understanding, like the other panelists said, being welcoming, asking questions and being able to answer those questions honestly, versus trying to either brush it, under the rug or ignore the question. And I think just really being honest about those specific concerns, and knowing that they didn't come to this decision a minute ago. So they're not going to change, like the thought process isn't going to change in a minute either. So understanding that this is a process, and having those conversations, someone says, no, I'm not really interested in talking about vaccines. And you say, okay, now I really care about your overall health. And so maybe we can talk about, we can table this conversation and talk about it at another time. Because I hear a lot of folks say, or folks who are vaccine hesitant will say, I felt pressured. I said, no, I didn't want to talk about it, but they still talk to me about it. And that then that shuts the door, right? Then that person definitely doesn't want to hear anything you have to say. So knowing that it's a process, and we just sometimes have to be patient.
I saw Christa come out. I'll just say something real quick because it segues well with Jacqueline. Absolutely agree. Again, using my friend Adam. He doesn't know he's my friend, but I made him one when I read the book. One of the things that he talks about, which I know that I have done before, is because we really do believe this is good for people. And I'll just say we have a tendency, especially as healthcare professionals, as scientists, et cetera, to just overwhelm people with facts and, really great, compelling arguments. Just like Jacqueline said, and all of you feel this way, as soon as you feel like you're being sold something, as soon as you feel like the pressure is on, actually, one of the things that he talks about is study after study shows actually people will double down on their resistance. So if we start trying to convince people that we're right, then actually we're going to push them away a lot of times. So we have to pick maybe two pieces of an argument, two little pieces of data, and go with them sort of mild. And then just like you said, and then ask questions and be open to it. Because again, what he says, we don't have to convince them that we're right. All we need to do is convince them to question what they have thought and start having room for other ideas about it. So
I think that is a great point, that on not overwhelming our patients with facts, because just a personal little segue, but not all of our patients are going to understand the technical terms that we're teaching here on the HSC campus. So, sometimes coming at it with too many facts can, like you said, like your friend Adam said, turn them the other way completely. I'm going to mute.
I was going to give a quick example from what Jacqueline said, just about genuinely listening to patients' concerns or people in your personal life, because I know that often these conversations happen outside of work and at home with our families or friends. I was in a conversation with someone who expressed some vaccine hesitancy, and when I asked why, she mentioned that she had suffered through multiple miscarriages and that she had read online that, does the COVID vaccine cause further infertility? And that was a true, genuine fear for her. And she was definitely open to hearing a short explanation of why I didn't think that was true from my experience. But then we kind of left the conversation at that, kind of what Dr. Kraft mentioned, giving patients and people room to think about things and make their own decisions. But after that conversation, I went and did a little bit of research to just find some evidence-based articles on why that wasn't true. And then I revisited the conversation with her at another point in time. And instead of giving her data, I kind of just talked her through in layman's terms. And I think I learned from that I think sometimes, especially in the age of social media, we see someone make a claim and we kind of just want to go find all of the articles and all of the data that we can and send them links and say, see, this is why. But our papers are very difficult to read. A lot of them don't make sense if you don't read science papers every day. So making sure that like you're doing your research and digesting it, and you're able to have conversations with people instead of just saying, see, look, like this is right here, but empathizing and having true conversation.
And to add to that, that we want folks to do their research, right? Because it empowers them. But the next step of that is when you have questions or something you don't understand, because you're right, research papers, scientific papers, there's a lot in there. Come back. Let's talk about it. Let's talk about questions that you have. And let's visit that, because that, again, that goes back to empowering them. It's not pushing information to them, giving them the space, and then let's have a conversation. I think sorry.
Oh, no, I just think that this is a great segue to my next question, which what are useful resources to give patients so they can feel that empowered, that they aren't just taking the spoonfuls of information that you're giving them. So if you guys have any particularly strong resources to give our patients, what would you recommend?
Well, I mean, I would hope that folks are sharing information from the Oklahoma Alliance for Healthy Families. So our website is www.okhealthyfamily.org. And so we have lots of information there to share, but also, obviously, CDC, National Foundation for Infectious Diseases, but also Children's Hospital of Philadelphia, CHOP.edu, has a lot of very specific, like just for laymen, like everyday folks, information that they can share or learn more about vaccines. We know also sometimes folks can feel a little hesitant about the information coming from maybe a state government agency. And so understanding that obviously your why, understanding where their why is will then help you identify appropriate resources. So we also know that there are nonprofit organizations, obviously like the Alliance, but also national nonprofit organizations like Vaccinate Your Family, are great resources to be able to share and have lots of content information.
Thank you. And thank both Margaret and Dr. Kraft for dropping in our some of our links to good information.
Yeah, I just want to echo. I think all of those suggestions are awesome. The Oklahoma Healthy Family Alliance is definitely a good resource. The CDC is an amazing resource as well. And what I dropped in there is just, and hopefully you can make it work, but you can go there and find it. It's a great PDF of all the vaccines, and they update that. And that's one thing that's important. And I think probably most people on this call know, but maybe not a lot of our lay friends out know, to check the date of the website. You know, the problem with Dr. Google is that you may get the top things people are looking at. That doesn't necessarily mean, you know, obviously that they're vetted sources. It also doesn't mean that they're current. And so I think that's an important thing, you know, if we're answering that question to people, to send them to those sites, but also then always encourage them, look at the date. Look at the date that was most recently updated. The link that I gave you was updated, I think, in October. So you want to make sure that you're getting recent information.
I think that is a great, like, to check the date of the websites which you're traveling to is a great thing to discuss with our patients that are perhaps a little bit more hesitant and moving towards anti-vaccination. That it's a great like reminder of like internet like safety and how to use the internet. Jacqueline, did you have something else?
Yeah, and just a little along those same lines, is it's so easy to share information, right? On social media, it's literally just one click. And so encouraging folks to sort of see if there's this one story that talks, or like a handful of stories versus, you know, 50 stories about a particular issue around vaccines. That's something like that should be a red flag. right? Like it's not a conspiracy. If there are five websites that aren't necessarily credible that are sharing this information, but you've got 50 on this side that has, you know, a lot of credibility behind it, that's something to think about.
Absolutely. On this, going off a little branch, my next question is, where, just some more general information can you provide to our audience about COVID boosters, or what is so different about this current booster that we're giving in, or we're offering to patients right now?
Yeah, so the bivalent booster that just came out, and the only difference in it, I like to explain it to my patients. I kind of compare it to the flu shot a little bit. Is the only difference is that instead of there just being one mRNA strand, there's now two, and it covers both the earlier strains of COVID and the new Omicron variants as well. So it's just mRNA from both of those variants that are combined into one vaccine. So obviously I'm not, you know, explaining mRNA to my patients when they're asking me about it. So I do like to compare it to the flu shot, and I'm just kind of like, you know, how do we have to get the flu shot every year? Because every year there's a different strain of the flu. That's kind of like what this vaccine is. We're just combining the protection against the virus into one vaccine. And that's why they want you to get the booster. It's not that the first vaccine wasn't effective or anything like that. We're just protecting you from the future variants of the COVID. So
I think that's a great explanation, and definitely an analogy I've used as well with patients. Do you guys, do our other panelists have a different way to think about the bivalent new booster, or are we just going to applaud Taylor for such a good analogy to use?
I think we'll applaud Taylor. That's exactly the analogy that I use when I talk to people, because it's exactly what it is. I mean, we're targeting two strains. We know that it mutated. We know that there's an additional strain, and we know that the first one, although is fabulous, this one targets the second strain a little bit better. And so you're just enhancing what you already have on board by getting the booster.
Absolutely. We're gonna move to my next question, which kind of goes away from just general information, but more just based on your experience. What do you commonly hear patients asking in a healthcare setting? Like, what are some of the common concerns or even myths that they are looking for more information about?
So we certainly work on, our focus is all immunizations across the lifespan, not just COVID. So we hear a lot of, I think someone had mentioned it already, I get, you know, I won't get the flu shot because every year I get the flu. And so explaining how that whole thing works, 2 weeks, you may have already had it and you didn't know it, kind of thing. Other, like, I'm perfectly healthy. I don't need it. Everyone else in my family is healthy. It's not around anymore. Why do we need it? I was fine. I got the measles and I'm perfectly fine. Or I had chicken pox and I'm perfectly fine. Those are lots of like opportunities to have conversations about, sure, you may have had chicken pox and was perfectly fine. However, the person that maybe is undergoing cancer treatment won't be fine. That impacts a lot of things. If someone is immunocompromised, the flu is not just the flu for that. For maybe a kiddo or someone who is working, the flu isn't just the flu for them, because maybe they have they work an hourly job. They don't have insurance. Now they have to take time off without pay, or they have to pay for a doctor to get, or don't have to go to a doctor because they don't have the money to pay for a doctor. So sorry, I could go on and on.
I think Taylor had also unmuted to speak on this one.
Oh yeah, so one of my favorite ones that I heard all of the pandemic, and I actually had someone like video me giving them the shot, was like the fact that I was microchipping them. And they were just it had to do with the safety mechanism we're using. It was a needle that, you pressed it a little harder and it shoots back into the syringe. And she was just very, very convinced that I was microchipping her when I was injecting the vaccine. And so I was like, well, what can I do to make you feel more comfortable with getting it? Because she had to get it. Well, she didn't have to, I guess, but it was one of the things where if she didn't, she was going to be let go from her job. So she was very hesitant about getting it to begin with. And so I just was kind of like, what can I do to make you more comfortable? And she was like, well, can I video you giving me the vaccine? And I was just like, I mean, sure, yes. Like, so I had to, draw it up in front of her, do all the things just so she would get the vaccine. That's one of my most recent examples, and probably like it wasn't crazy, but just kind of like, I was like, wow, okay, like, let me do this for you. If it makes you feel better, great. But then other things that I hear all the time are like, oh, well, would you get the vaccine? Are you letting your children get the vaccine? Are you doing this? Which I think probably a lot of us have, as healthcare providers here, because we are, a trusted resource to the public. And so that was one, and even not relevant to COVID, also like with any vaccine, it's, are you getting this, things like that. So.
And I think, Taylor, you bring up a really good point just about transparency. So I think the number one question outside of, the more extreme beliefs or assumptions about vaccines are people just want to know what the side effects are. And I think when those aren't explained to people thoroughly and transparently, if they go home and feel like crap after their shot, that could also fuel more hesitancy or more like, I had no idea I was going to feel, have an awful headache or get a fever, it made me sick, those sort of things. So by far, I think that just being honest and explaining the most common side effects that are completely normal for vaccines is the best for both patients and providers for future interactions. And most people do that, but sometimes it just gets busy, or we hand them a sheet and they don't read it. So I think it's important to verbalize those.
And I'll just jump in real quick, because as a science nerd, totally, I think it's a great opportunity when people say that I took the flu shot and it made me sick, or I did this and made me sick. It's such a great opportunity to teach on the immune system, because it couldn't have made them sick. It's dead. There's nothing in there that can do it. But guess what? That means that your immune system knows how to work. Those side effects that you feel, that's your immune system kicking into action. And I am total nerd on that. But I have had some people, because what we have to realize is that we're making assumptions sometimes of what people understand about science. And I really feel like there's a lot of times people do not have that basic understanding of science. So it is an opportunity to say, this is the fabulous way that your body works. And that's what you're seeing when you have those side effects from it. So I know that sounds a little crazy, but for some people that we've had that conversation, they're like, oh, okay, that's cool. I'm glad to know that. My brother was one of those people, and he's like, I'm going to go to work tomorrow and show off with everybody, because now I know something that they don't know. So take that opportunity. And then I was going to say, one of the questions I get, and this is just, just basic questions. Can I take them together? Can I take the flu shot and the COVID-19 vaccine together? Can I take them if I have a cold right now? And to me, those are great questions. Please bring them on, because the answer is yes. Put them in separate arms so that we know, which arm may be a little bit more sensitive than the other, because of all the CDC data that's being collected on everybody that's participated in the trials. If you have a cold, yeah, go ahead, because we definitely want you to be protected. If this is the opportunity that we have to get it in your arm, let's do that. But I love those kinds of questions, because you already have that motivated person. They just want to make sure it's the right time.
Yeah, I was going to say that I could personally share my own story. Last week at our OU run clinics, I was a vaccinator and got my both shots in the same arm, and my arm was sore for multiple days. So you can tell patients it'll happen if you don't split them up. Your armpit will swell. It's a whole shindig. But I'm going to transition to kind of our last question that I have before I will open it up to our audience members. And this really focuses on how to transition from being that provider mindset from I am X member of the healthcare team to our personal relationships. How do you guys bring up this conversation when you're in a personal relationship where this person doesn't necessarily see you as your title in the healthcare field?
I think that's just a super great question, because one of the things that I've learned working in a retail setting with patients is they respond better when you are more personal with them. I don't like to call it like small talk. And I know sometimes my preceptors get so mad at me because they're like, Taylor, you take forever when you're counseling patients. And I'm like, listen, like, I just want to know about them. I want to know their story, you know. I think that's so important just to make it more of a personal conversation. Like, one of my favorite things to do is kind of what Christa brought up earlier, is just kind of bringing up the why, like why I got vaccinated or why I would do this, or like kind of what I would do. And I think that that just makes the conversation a lot more personal. It makes it feel not so like I'm talking down to you because I'm smarter than you and you should listen to me kind of thing.
Absolutely. I agree with that. Anyone else want to take a stab at that question?
Yeah, I think this is probably the most impactful part of working against vaccine hesitancy or resistance is in your personal life and your personal conversations, because those are relationships that are often revisited. And so you can revisit a conversation multiple times and you can talk through things together and learn new things together. So if you know there's specific fears or concerns, you can go look that up and revisit the conversation later with them. And also you can better understand, maybe it's not fears or concerns, maybe it's some sort of barrier they have to getting vaccinated, and you can help work against that. Like specifically, maybe they don't have transportation and you can give them a ride, or maybe they're very, very anxious about getting shots. I think that's another part of hesitancy that we don't talk about a lot. People are just very afraid of anything in the healthcare field. They don't like doctors or nurses or needles, and they just feel uncomfortable. So you can be a friend to them, you can comfort them and get them through that situation. So another thing I wanted to share, I can drop it in the chat, but a few students and I last year created kind of a little document that was a toolkit, and it just has some quick tips and information on how to talk with your family members or friends about getting vaccinated, specifically for COVID-19. But I think that those principles can probably be transitioned to other vaccines, because I know there's hesitancy to multiple right now. So I'll share that in the chat.
Thank you so much for dropping that toolkit. I know that was an achievement for our students last year to create that. We are about to open it up for general Q&A, but I do think that Ms. McDaniel's had me host this, that we have a Stand Up for Science conference coming up on November 4th at the Nicholson Tower. Jacqueline, did you want to say a few words about this?
Yeah, thanks for sharing. We are super excited. This is our first annual Stand Up for Science Immunization Conference. It's a one-day, and we will have Dr. Andrew Kroger from the CDC. He will be our keynote, and he will talk about vaccine misinformation and the unfortunate return of vaccine preventable diseases. We'll also have a panel talking about vaccine misinformation and providing tools and strategies of how to address those misinformation. Really, a lot of the stuff we've talked about today. But Dr. Kroger will also be on that panel. And then we will have Dr. Larson. She is also on the panel. She is an an OBGYN out of St. Francis in Tulsa will be on that panel to discuss that. Another panel will be an advocacy and policy panel. Representative Marcus McIntyre and Senator George Young will talk about sort of policy around vaccines and advocacy. And we'll also have Catherine Milliam. She started Moms for Masks back when masks was a huge issue with Senate Bill 658 about a little over a year ago, when schools could not mandate any masks. And so she really advocated and mobilized folks across the state and even really across the country. So we're super excited to have her. And then lastly, what I think will probably be really interesting for this group is that we have a panel to talk about doxing of healthcare providers. This is bullying and harassment, whether it's online or in person, for those healthcare providers who have been targeted because of their stance on immunizations. We'll have a pediatrician from Enid who will share her personal experience of what that looked like for her. And then we'll have someone from the OSBI, cyber crimes, to talk about what folks can and can't do and what their rights are, as well as someone from a PR public relations firm to talk about ways you can protect yourself online and how you respond. So we're super excited. We actually have scholarships available. So if everyone wants to participate, more the merrier. So just I'll drop my email in the chat if that's okay. If folks are interested in attending, just send me an email.
Absolutely. Thank you so much. And then finally, I'm just going to remind everyone that as a OUHSC, we do have flu clinics going on. There's one going on today until 7, or I believe until 7 or 2:30. Just kind of depend, check the times. On Friday, it will be at the Bird Library patio. And that is going to be during kind of extended hours for 8:30 to 5 p.m. So if you're on campus, I do recommend you go get it if you haven't already. And then I now invite you to fill out our QR code, our attendance code. And if you would like to ask questions, please drop it in the chat or turn on your mic. Thank you so much.
Bruna asked a question already about the vaccines availability. The monovalent vaccines that we have had are still what's recommended for dose 1 and 2. So the first 2 doses of the primary series, they are recommended to get the monovalent. The bivalent, you're right, Bruna, is the recommended, regardless of which number of booster it is, to get the bivalent. And Taylor can also jump in here, but one more thing I'll say, which is so cool at the vaccinator level, is that with the bivalent, we don't make them stay any longer, which is so very exciting. As you know, it may seem like a small thing, but not having a room full of people sitting there for 15 minutes having no response. I mean, it's great that they don't have any response, but they don't have to stay, which is awesome.
Thanks, Melissa.
And Bruna, that sheet that I mentioned, and I can send it to you, the PDF, it is a fabulous PDF from the CDC that lists every single one of them that's available, the dosing and how it's done, monovalent versus bivalent for those doses.
So we have a question in the chat that asks, at what point in the conversation with a patient who is adamantly refusing do you, quotations, give up? And then how do you handle that realization that in spite of your attempts at education, that it's just not coming across?
I think this is such a great question, actually. So I feel like all the time when I'm counseling patients, it's always like, you know, they either want to listen to you or they don't. And so that's something that, like, as a healthcare provider, like, you can't let it hurt your ego, you know, like if they don't want to do what you're telling them to do, you can't force that to happen. I can't go home with you and, make you take your insulin or those things. And so I kind of look at vaccines the same way. All I can do is educate the patient, listen to them, answer their questions, and just hope that I've done enough to make them want to get the vaccine. But if they don't, then there's not really anything I can do. I feel like kind of how I handle it is I just, do my whole spill, and then I'm like, what questions do you have for me or anything like that? And then if they have more questions, I answer those questions, and that kind of you can I guess gauge if they're interested or not in a vaccination at that point. And so then, if you're not really getting anywhere, it's kind of I just kind of like end the conversation. Like, if you ever have any more questions, like, feel free to call me. I'm here anytime, like those kinds of things. So I wouldn't really call it giving up. I think there's just a point where you kind of just have to like accept that you can't control what your patients are doing. All you can do is just hope that what you're saying to them is kind of, they're able to think about it.
I think you bring up a great point of leaving that door open for the patients to revisit this conversation, that it's perhaps not a one and done conversation. Perhaps this is something that you're going to have to talk to them about every time they pick up their prescription or every time they come into your office.
And it could mean, just maybe going into it, understanding that the goal is to understand, not to change their mind.
Yeah. I don't think that we can change everyone's mind. We can only present the best information available. Did that answer your question, Daniel? David brings up a really great question of how do you approach a situation where a minor wants to receive a vaccine, but their parents or guardian is not allowing them due to hesitancy? I can't think of a great answer. I think it's a very tough question.
Well, I'll come in there. I think it is a great question, but they are a minor and we do have to respect their parents. And I think back to the previous question, as much as possible, just like my good friend Adam, it's not about us being right, even though we have a conviction about it. It's about giving space for that individual to have the determination decision, but creating maybe some doubt about maybe the thought that they could be wrong. So if the parent is there and they are willing to kind of have a conversation with us, I think back to that question, what would help you feel more comfortable about your child getting a vaccine? What would it take for you to feel comfortable with allowing them? And if you could just, that goes back to those asking the questions to understand where they are. And that's all we can do in that situation, or when it's an adult that is, really adamantly opposed. We respect their right to make those decisions.
Assuming that maybe you're absolutely right, assuming that maybe young person is there by themselves, providing them with the tools and maybe asking the why their parents are hesitant, and providing them with the tools to have those conversations with their parents empowers that young person too, as well. So that's another option that might come up.
Cindy in the chat brings up a great point that as providers, it is incredibly important to document these conversations that you're having. She brings up the point that there have been lawsuits over these missed doses when the person later got the disease, and perhaps that's more civil suit, but I'm not involved in law, so I shouldn't make comments. But I do think that is something incredibly important to do in that situation. I think we have time for one last question. But otherwise, thank you so much to everyone who has attended today. And can I get a round of virtual applause for our panelists? and just giving them a huge thank you for coming and spending their lunch hour with us today.
And applaud yourselves for being here. We appreciate all of you.
Absolutely.
All right. At this point, I'm going to end the meeting. Thank you all for attending.